reports when I get up from a lying or sitting position to a standing position. I'll feel very dizzy.
I'm checking my blood sugar level, and I do this before every meal. So when I go to a new school, I'll have to share my condition with the people around me. Okay.
Is it hard for you to ask your mom whether you can go out?
Not really. As long as it doesn't affect my studies or like during exam period, it should be fine.
For me, it might take a while for me to get permission. They are concerned about my safety also. Some injuries occurred.
For haemophilia patients, even if they never injured themselves, they will have spontaneous bleeding, which is very scary.
There's just one worry. If something happens, can he handle it?
I will be more comfortable if he just don't go that
So
far.
if something
walk
happens, you can still push the wheelchair to him. If you go too far, then cannot reach.
The biggest issue that comes in my condition is the unexpected injuries. These injuries may happen anytime, anywhere, so I cannot foresee. That time I went with my sister to buy something, and then halfway through, I actually felt some pain on my left knee. The pain was like a stinging sensation. I couldn't walk because the leg was very swollen. My sister called my parents to actually fetch me on the wheelchair back home. So I always had this wheelchair on standby at home. 妈咪，我回来了。哇，做工啊？还没有做完啊？
还没有刚刚。晚上
哇，你做工这样开心的？
看到你就开心哦。
I'm thinking of asking my mom again today whether I can go out alone. I think she's in a good mood. I think I have a 70–80% chance of getting her permission to actually go out myself.
这个 weekend 我会很忙，要做工。
我可以自己出去啊。
你要去哪里？
Orchard。
你就要去周末？你自己去干嘛？
因为我现在长大了，等你们有时候也是忙，但有的时候也是要出去走走一下，不只是说去楼下这些而已，自己也是开心嘛，有可以独立，对不对？
我想到一个地方
什么？
你可以去 library
Vivo City Harbour Front Public Library 这些的。
你去问你爸爸，你爸爸讲 OK 的话，他就 OK。I'm more comfortable for Jue Ming to go to the library because if anything happened to him, he can actually get help easily. I don't want him to actually wander around in the street doing nothing. I'm still worried that he go out alone, but I understand that now he's actually a teenage, so I want to actually give him more freedom.
哎，老爸，
没事。
我昨天问妈咪可不可以去 Vivo Library 啦？
自己一个去啊？
自己去啊。
Usually, I will have more concerns than Jue Ming's dad because Mother Nature.
She's more careful lah. Usually, when Jue Ming approached me, I would say yes.
我差不多dinner time回来。
Okay.
So for lunch, I'm having this chicken curry rice from the Japanese food store. What's that? That's my medical device. So I can check my blood sugar levels. Put your blood on it, then after that it can sense.
yourself?
No, look. That's why I put this, right? Very little lah. Okay, you just squeeze. You squeeze, right?
That's actually scary.
See, it's done now.
Like every day you have to go how many times?
4.
Huh? Like when?
Before meal. So before my breakfast, lunch, dinner, at night, before I go to sleep. The condition that I have is type 1 diabetes. Type 1 diabetes is when your body cannot produce insulin, and then you would have to inject insulin so that your body sugar levels won't be too high and too low. I think they were a little bit shocked. After that, they had a ton of questions. How are you doing? I'm checking this app.
What's that?
It's like you can check your carbohydrates. So for example, I put curry, chicken, rice. Then right, I need to put in the carbohydrates in my meter, which is 85.2. Now I will check this thing and just
Isn't
put
that the
it in.
thing you just got just now? What does that
Yeah.
connect to?
My butt.
Huh?
There's a needle inside.
Is it
Yeah, no
big?
joke.
What?
You just need to change it every 3 days.
Do you shower?
Yeah. What do you think?
What are you doing?
This is how you're gonna get injured.
Well, basically, it's just having fun, man. I know when to stop, and he knows when
Yeah.
to stop. There are 4 of us. I guess it's like any sibling relationship. Sometimes we squabble a bit, but other times we get along.
Here's Dominic in action, doing some minor wiring work. He's preparing the Chinese New Year lanterns to be put up.
He's not defined by his condition. And when people ask like, oh, who's Dominic? First we'll be like, he's my brother, you know? And then hemophilia is really one of like the last things that you would bring up.
Good job.
As a kid, he used to get injured a lot more frequently. So my parents would just rush him off to the hospital. And a lot of his bleeds happened to happen at night. I was very used to one parent staying overnight at the hospital and then the other parent staying at home with us. As a kid, he used to get injured a lot more frequently. So my parents would just rush him off to the hospital. I was very used to one parent staying overnight at the hospital and then the other parent staying at home with us. I didn't feel so neglected or anything because my parents did a good job trying to like manage between Dom and us. I think it's also because the age gap between Dom and Esther is only 1 year. A bit like a replacement in a sense.
So mean! How could you say that? You literally said replacement, not a replacement.
It's like a... When Dom wasn't around, I still had like Esther to play with. So I didn't feel so like left out or lonely.
A replacement.
What do you know about that condition?
A bit of a bio lesson. All females inherit 2 X genes and males inherit 1 X and 1 Y gene. In genetic cases, because it's passed through the infected X gene, and boys are born with only 1 X gene and so they would have hemophilia. But girls, on the other hand, because they have 2 X genes, so if only 1 X gene is infected in that sense, then they are just a carrier. So there's a really low chance that girls can get hemophilia. They need to have both X genes that have the hemophilia. If not, they would just be a carrier. Say I'm a carrier and I have 2 X genes, one with the hemophilia gene and one is a normal gene. I might pass on the hemophilia trait to my son if I pass on the mutated X gene. If I pass on my healthy X gene, then he would not have hemophilia.
In this case, there's 4 of us, but Fred, our younger brother, he doesn't have hemophilia.
My mom did a preliminary test, which ruled out that she was a carrier of hemophilia. So our belief is that his hemophilia was spontaneous.
Chicken dance.
You already dance. Knowing about hemophilia and the possibility of such mutations happening, I would also want to like get myself tested.
I was not born with POTS. I was perfectly healthy for the first 15 years of my life. I started experiencing symptoms in Sec 3. I was in Girls' Brigade in secondary school. I was unable to do a lot of the physical training exercises. I thought it was because I was unfit. At the end of J1, I was on my way to school. I suddenly felt feeling really dizzy and passed out. But I was very fortunate in the sense that a passerby saw me. When I woke up, I told her I would make it to the hospital on my own. My parents visited me in the hospital and they said it looked a lot like I was faking it to get out of school. My parents have only came for one appointment during the diagnosis journey. My parents pay for my medical bills, but they are not very involved in my medical care. So I make a lot of decisions regarding my condition on my own. I didn't have the support I thought I would get from my parents. There were times where I felt very lonely and I was frustrated. In the process of getting my diagnosis, I have went through multiple medical tests. Even after all these tests, no doctor could tell me what my diagnosis was. Because I didn't know how to manage it, it made my condition a lot worse. During a flare, everything hurts. Your heart rate is consistently very high. Your hands tremble a lot, so I was stressed, worried, depressed a little. Every few months I would have a flare and it would land me in the hospital, which was frustrating because even if I went to the hospital, I didn't know what was wrong.
When Constance was 5 years old, my husband and I, we were due for an incentive trip to go to New Zealand.
We have a call from, I think, my brother that Constance is having some issues with her leg. Her leg is swelling, then there's a reddish hue, it's shiny.
I had no idea what happened.
So Constance was brought to hospital. She was admitted for the day. In hospital, she was diagnosed as HSP. So it's more of inflammation of her blood vessels that cause some purple patches that develop.
We just thought that HSP will recover by itself. Yeah, it's a matter of time.
But I noticed that Constance do wake up to go toilet, or then a few times she wet the bed. And she's able to wake up in the middle of the night to finish up 2 huge water bottles.
Then we realized that something is not so right anymore. My husband found out that, hey, could it be due to something linked to diabetes?
So we asked her to do a blood test, and the nurse told us if there's anything important, then she will call us. So it's like praying, don't call me, don't call me. But the call came.
So when the nurse told me that please quickly send your girl to A&E for quick treatment.
Her blood glucose level was very high. They told us that she needs to be injected with insulin to bring down the glucose level. And we are told that she's diagnosed to be type 1 diabetes.
We were quite surprised and shocked that, hey, why is this happening to her? Yeah, especially to a young girl. I'm not sure where she got it from because it's not genetic. My family lineage and his doesn't have this condition. When the doctor mentioned that it's going to be lifelong, yeah, it broke our hearts.
Today I got back my HbA1c results. It's my average blood sugar reading for the past 3 months. The previous time I took my HbA1c test, I got 7.2. But this time I got 7.7. I'll try my best to ensure that I limit my sugary food intake and ensure that when my blood sugar reading spikes, I inject myself with some insulin. Starting CCA meaning longer school hours, and this means that I'll have to take more meals in school. So when I take more meals in school, I have to calculate all the carbohydrates and ensuring that I inject myself with the correct amount of insulin.
I'm going to the Vivo City library today. Yes, I'm very excited today. Yay! 哎，我要走了，拜拜，妈妈拜拜，爸爸拜拜。要乱跑啊 ？OK。I'm going to take the bus and then change to the train to go to Ocean Park. And then go train to a North East Line to Harbourfront. So yes, I'm finally at Vivo. I'm very happy and quite proud of myself that I get to go on my own. I'm actually quite confident that if injuries occur during this trip, right, then I can handle it myself because I have a cold spray and then there's a lot of seats around here so I can take a rest. So I'm quite confident that if something happens, I can manage it myself.
How is the palpitations coming along?
It's bad. Honestly, it's bad. So I'm getting some nausea along with it.
Would you say you get it once a day, 4, 5 times a day?
Maybe about 6, 7 times a day.
Venetia was referred to me because of her palpitations. When she presented to me, I realized she was extensively investigated by multiple physicians. All of these test results were essentially normal. What was not looked into was the possibility of Postural Tachycardia Syndrome, or POTS for short. POTS cannot be cured, but it can improve with time and certain interventions.
I was relieved also because, finally, if I have a diagnosis, I can get treatment. It was an actual medical condition, but I was scared too. What kind of implications? Because at the point of time, I was in nursing already. Sometimes where I'm just like, why me? To have a medical issue plague you when you're so young and to have your entire career possibly be destroyed by this. Yeah, frustrating.
Certain exercise regime can help you. There are a lot of exercise that you can do. Now, often it's a struggle with patients if they try to do this on their own.
Okay.
Get physiotherapists involved, professionals who can arrange a program for you.
Okay, all right.
Prepare yourself for the prophylaxis.
10天50。
你自己看。
但今天是15，就刚好10天这样子。I'm now undergoing this treatment called Incurable, which is a factor 9 therapy. This treatment will help to prevent bleeding episodes that will happen to me. I think it's quite effective. Now the injuries that happen to me is not that often now, maybe once in a few months.
你渐渐要懂得打，就是说怎么打啦哈。最好是一次你就成功了 ，OK？
一次就成功啊！不可以咳，不可以拿，不可以动 ，OK？A few years back, before we started on this long-acting factor, I actually had to go to a hospital twice a week to get the injection. It actually wasted some of my time. Around 3 years ago, I switched from injection at the hospital to home infusion. Switching to the long-acting factor, I would say one of the benefits is saving time.
Okay, you squeeze and let go. Can
I need to see it a bit.
Yeah, here.
Here. Okay, it's show time. 这里，还没有帮我看一下，对不对？
The angle higher.
对。
Higher a bit. Okay, breathe in. Hold. Go.
打进马上，帮我一下。
Okay, let go. I think it's.
你先拿出来先，打进马上。
好像 OK 了。
有点打进马上先。等下你先拿出来先。
如果不行的话就要换了。
打进马上了。
别。这里。
对。
Breathe in. Hold. 不知道是不是因为最近天气冷，他的 vein 全部看不是很清楚。
停。哇，好像有点打进去马上面。
Okay, give me a gauze. 这个比较高。
try 了。我是怕更痛。
可以了，OK。
Ready? Within. Hold.
等一下
OK。
等一下，刚才有点打进马斯那边去。
So it's here.
I think so, yes.
Within. Hold.
等一下打进那马斯，没有打进那马斯。
好。
等一下等一下
不可以嘞。
他一直打进那马斯。
哇，今天怎么回事啊？
你们一直打进那马斯。
你要去常做运动啊，弟弟，你的血管看不到，你懂吗？
对啊。
喂，你要再试吗？
不要。
去1人1哎。
No choice, have to move up. Just 4 tries already. Yeah.
喂，老爸，怎么在哭？哎呦，冇嘢啦。
頭先打唔到啊！
冇嘢啦，又埋你打，係我打嘅。
Because of the
unsuccessful
yeah.
infusion.
So we have to leave it to the professionals. It's better to stick to the schedule because the longer you drag, the less the effect of the medication. So his risk of whatever complications will be much higher.
I felt quite disappointed. The whole purpose of this whole infusion was so that I didn't have to go to hospital, you know.
We joke around the house calling it liquid gold. This is 3 ml of Haemophilia, and it costs $31,000 without subsidy.